Here I am, Dr. Elsie Coe. We're doing our weekly physician interview series, and so happy and grateful to have Dr. Chris Esguerra on. Hi, Chris.
Hi, morning.
So happy and grateful to have Dr. Chris Esguerra. He has a wonderful topic to discuss today. I'm Dr. Elsie Coe, CEO and founder of Lead Physician, which is an online interactive virtual program that empowers physicians to really uncover their potential and lead the field. Each Sunday, we interview select physicians who inspire and teach us tips and tricks on how they became successful so that we can learn from them to be better providers. Dr. Chris Esguerra is from Pasadena, California. He's the Chief Medical Officer of DME Consulting. He's also a physician advisor and an entrepreneur. And what's very unique about Chris and why I wanted him to be on today is to share with you what he's been teaching, actively teaching residents in California on emotional intelligence and why that's so important and a skill that's left out in our training that can really booster physicians in the field of medicine. Hi, Chris.
Hi, thanks for having me.
So Chris, let's start off by telling us a little bit more about yourself. What do you do at DME Consulting and what have you done outside of that?
Definitely, and thank you. So DME Consulting Group, I'm the Chief Medical Officer. And what our company does is on behalf of health plans and health systems, we go into people's homes and assess them for safety, function, all with the goal of helping them stay at home and prevent unnecessary hospitalizations, skilled nursing, facility admissions, falls, everything, all through that, but also making sure they have the right equipment, the right services, and even home modifications if that's part of the coverage. So we're national. And the whole idea here, and it's nicely concordant with my own sort of career purpose, as really integrating all of those things outside of the four walls of the clinic, addressing social determinants, social needs for individuals. And in addition to that, and I've been more and more doing this over the years, I advise and consult with a variety of healthcare startups, usually in health tech services, and a variety of things. The largest thing lately has been interoperability, and also with nonprofits, organizations that have historically not participated in healthcare delivery, but are increasingly realizing they need to, and how is it that they're going to do that?
That's awesome. And tell us a little bit about your experience with mentoring and now really formally teaching residents and why we as physician leaders really need to step up and help with that.
Yeah, definitely. I think it started actually with mentoring first just colleagues that were getting into the more administrative, the more strategic work that I was already doing. And my history of getting into leadership actually started right out of residency. My first role was to oversee an integrated primary care behavioral health program. And the first thing given to me was, can we find out if this program is even financially viable and is it making money? Because we might close it if it isn't. Quick crash course in understanding, one, calming everybody down, because you hear that news, everybody's going to, have a lot of anxiety, but also understanding finance as it relates to healthcare. Residents are not taught this whatsoever, let alone how then to manage people. And it was over several months where there was a lot of learning on my end, but also understanding that we got to uncover some really interesting things. We were actually making money. It just so happens that that money was siphoned off and credited to other programs. So we got to take our credit back.
Nice.
And that's what led me to pursue my MBA. And I'll really start to apply both the formal learning, but the ongoing experience with that. And so encountering other physicians along the way who were wanting to do this, it became a lot of informal mentoring relationships. And the nice thing, relatively recently, my residency program, my mentor, who actually did a leadership course for us, it was a little unstructured, decided he was going to move on with his career. And we talked about me taking over. And we worked on designing the course and focusing on really two areas, leadership in organizations, and then also really thinking for the residents about their own career. So elements such as not just what is on your CV, things that you have done, but also how are you known? How are you perceived out there? So we call that your PV, your perceived value. And and then techniques related to getting your first job and beyond, such as negotiation and understanding what the market is, and as well as your value. And also the other piece is, how do you manage your career? How are you continually mindful about it? You know, we physicians are put in through for the maintenance of certification, all of these things from a technical perspective related to our fields. However, it's really important to be thinking about other skills such as emotional intelligence that we need to continually practice and to continually evaluate for ourselves.
That is so good. I mean, I wish I had you when I was a resident. Although I'm probably older than you, Chris. But that's so. What has the feedback been with the residents so far?
They found it valuable. And
Hmm.
one of the last comments, since we just finished our course, we're going to be doing it for 6 weeks every year. So it's modular in that sense. And so there's one year that covers certain topics, other years that repeats key topics, but we add some others. For example, next year we're going to go over, let's understand the healthcare system. How does money flow? Why are things the way they are? Because as physicians, we feel like we're just a little cog in this big thing, powerless. And I think knowing that is important. And one of the interesting pieces of feedback, apart from, you know, very much well received, they felt it was really helpful for them in their stage. These are sort of in PGY3s, PGY4s, so getting there close to graduation. A couple of them said, you know, this would have been interesting in the first year, if nothing else, for me just to be aware. As PGY1s, you know, we're focused on just getting through intern year, but to have it in the back of their minds, to be knowing that emotional intelligence is something they have to pay attention to. Understanding organizations is something they should start paying attention to. And so just even that intro there, and then developmentally going through in their own training. And the other thought is then seeing, what does that look like after training? And how do you keep up and pay attention to these things?
Right. And that's why I think it's so important for us to be live here on Facebook and telling everybody. So tell us a little bit about the emotional intelligence piece. Why do you think, and you know, I thank you for sharing some of the articles too with me that you've had, Chris. Why do you think emotional intelligence is so key to not only the success of the residents, but yourself and your own career?
No, definitely. I think so I'll start off with, I will sound biased because I'm a psychiatrist by training. However,
Okay.
it's not just about that. I think ultimately it helps us understand our context in systems. And part of emotional intelligence is really understanding oneself. And the way to think about it is this triad of focus. There's the focus on yourself, focus on others, and then this outward focus of, what does that mean, of what context, what are the systems? And with emotional intelligence, those aspects such as empathy, motivation, self-care, all of those things are things we need to start to think about cultivating. So as physicians, especially through med school, through residency, we are completely motivated by, rewarded for achievement, getting things done, very much outward focused type things, and pick whatever in terms of achievement, whether it's, you know, passing that test, finally getting that attending salary, paying off the student loans. These are outward things. In no way are we promoted to or be encouraged to be thinking about our own internal sense of self, and that how do we use that sense of self to work with others and then working within a system.
Right.
And what's been interesting, I remember one of my recent mentoring discussions with a colleague, because he was feeling frustrated that he was feeling like a cog and that everybody just thought of him as a physician, and he really wanted to contribute in this larger systems way and really pushing through his hospital system's ICU strategy. And he's a peds ICU guy. And then we really talked through this idea that unfortunately, we physicians among each other will respect the work and our expertise that we each have. Yet when we are thinking about the greater context of everybody else who's not a physician, who also is in leadership, we may get typecasted. And how is it that we pick up on these things? How do we acknowledge that, as well as then how do we use that, leverage it in such a way as, yes, the physician role is really important, the physician voice is important. How do we make sure others hear it? And that's important. And there's a humility in that, in stepping back and saying, wait, I realize in this whole room of non-physicians who are also leaders and have their own ego, their own territory, their own agenda, how is it that I step back and acknowledge that my voice may not be heard in the same way as if I'm in a room with a bunch of other physicians? And that takes a bit of practice, and it takes that self-reflection.
Absolutely. I mean, we learn, and I was admittedly early on in my career very reactive, and I judged my success based on my external environment, where it should be the other way around, and we should lead from inside out instead of outside in.
Absolutely.
So so in terms of your own career, how have you found being, you said you're saying psychiatry is different from what you're teaching here. How have you used emotional intelligence really to, push yourself to, to the roles that you have and succeeding, and you're influencing people? How has that really shaped you?
Yeah, definitely. I'll start with this small story of my first trial by fire in the most memorable way role. So this was my first getting into working with health plans. And this was with a health insurance company that covered folks on both Medicare as well as Medicaid. So folks with low insurance, usually a lot of comorbid conditions. It was very community focused, which is great. And the title of the role was the director of behavioral health, and really helping them with their strategy. And I thought, this is great. I get to start working at a population level, covering the county. Awesome. 2 months into it, my chief medical officer turns to me and says, after the usual orientation work, I'm burnt out. I'm going to step down. In fact, I'm going to be out for a couple months. You're it as deputy CEO, or sorry, you're going to be it as actually interim CMO. And I've never taken a role. I've never worked in a health plan setting before. And my response was, why me? And her response was, you're the only one that actually happens to understand the operational aspects of these things, and you've done this before. By that time, I'd had my MBA, and so she used that as a proxy. And in my mind, I'm thinking, okay, wow, how is this going to happen? And so the emotional intelligence work really was, okay, let's acknowledge this anxiety. Let's also acknowledge the amount of the work and the scale of it. And so understanding that, but also acknowledge the fact that this is a really interesting opportunity to learn, but also be able to understand the system well. So in a way, it was feeling like being thrown in the midst of an intern rotation and just going for it. The thing I kept reminding myself, and I ended up reminding my team this, is, you know what, we're not going to kill anyone. So, which is great, because we're not in a hospital setting, we're administrative, this is wonderful, so stakes are not as high. That was helpful for about 5 minutes.
I was going to say.
Yeah, and the reason why is because so fine, I took the steps to begin, so there's the piece where I had to learn the role, but also all of the regulatory pieces that I was going to learn over time, but now just much faster. But then also understanding the teams, their roles and their functions, and understanding each individual and in the teams, because I had then leaders now reporting up to me as well. And what, again, in training and in clinical work, we're thinking about accomplishing things for the purposes of a patient. Now we're thinking, I was having to think about accomplishing things for the purposes of a population of individuals. And so that's broader, as well as making sure we're compliant. And in one particular area, as I began to uncover things, realizing, oh, if we were audited right now, we would be shut down. And So we went about then just how do we systematically work through some of these things? And I realized while the very physician thing to do is fall on expertise and how we can quickly gain knowledge and apply it. And I realized that became really secondary quickly. And that the more important thing to do was how is it that I get to both manage my team's anxieties as well as get them to be able to operate on and perform on all of those requirements. And so that's that outward, that working with others focus and really being able to modulate myself so that I can be of use for them. And what that actually taught me, this idea of leadership, is my role ultimately is not to be the expert. Definitely there are times where it's useful to demonstrate that expertise. However, it's not to be the expert. It's not to be the smartest one in the room. It really is to be the one to be able to help people think through things, as well as to be able to get rid of barriers so that people can get things done.
So good. Because how often we're taught to be the experts, and then
Absolutely.
our egos are defined when we're so young and we're still impressionable to define ourselves based on the expertise that we deliver, and people would treat us that way, so we act that way. But it's
Absolutely.
not that. That's not how to be a great physician leader. That is so. What a great example. Thank you so much. Chris, how can people reach out to you if they want to get more information with what you do?
Yeah, definitely. So LinkedIn, easy enough, Chris Esguerra, MD, MBA. And the other piece is I do have a website that you're able to then contact me. It also points to my LinkedIn. It's www.esguerra, ESGUERRAMD.com.
Thank you so much. You know, you inspire me, Chris, and I want to be able to deliver a percentage of what the proceeds for Lead Physician to provide scholarships for residents as we grow this practice. And I would love to see, Chris, some kind of partnership with you on this, because you seem like you're just doing a fabulous job. Thank you
Definitely.
for everyone for watching. Again, if you're that physician who's looking to make the next leap in his or her career, check us out at leadphysician.org. Or if you're a physician leader who has an inspiring story to share with others, please reach out to me at info@drlcco.com. Thank you everyone for watching.